Autoimmune diseases are basically a group of diseases in which the immune system finds a way to attack itself. Rheumatology often deals with arthritis, joint pain, but it can impact muscles and a whole bunch of other musculoskeletal areas. Specialty which is mainly around joint pain and arthritis. However, it is a bit more broad than that. It's actually very complicated to explain because of the big thing that we often deal with, not to be mistaken for a surgical-based specialty.
Welcome to Dr. Farrukh podcast. We are honored to have Dr. Mueed Mian with us. He is a consultant rheumatologist in Australia and he will be giving us the valuable insight about how to prevent and avoid autoimmune diseases. So welcome Dr. Mueed.
Thank you.
What is rheumatology and what are the common conditions in it?
So, rheumatology is a field of internal medicine. It's not to be mistaken for a surgical-based specialty. It's a specialty which is mainly around joint pain and arthritis. However, it is a bit more broad than that. It's actually very complicated to explain because of the big thing that we often deal with is autoimmune diseases, and I will go into that shortly. So rheumatology often deals with arthritis, joint pain, but it can impact muscles and a whole bunch of other musculoskeletal areas. But not only that, it can impact other organs as well, and that very much depends on what the autoimmune disease is. Now, autoimmune diseases are basically a group of diseases in which the immune system finds a way to attack itself. The immune system is something that I often equate to similar to the military, in that its job is to keep any bad guys out. And in the immune system, when we talk about the immune system, the main thing that we are aiming to keep out is what we call pathogens, or things like bacteria, viruses, anything that's foreign. It tries to reject it, kill it off at that spot so that you do not become sick. What happens in autoimmune diseases is that for some reason, and it's not very clear why, the immune system starts to attack itself. And that attacking of itself is what leads to a lot of symptoms, and that's where my specialty comes in. There are quite a lot of diseases, but the main ones, I guess, that I would mention are osteoarthritis, which is the most common by far. And often when you think of arthritis, you think about an elderly person, and that is often osteoarthritis, which is what we equate to cartilage loss, or where the bones are very close to one another, and that's leading to symptoms. However, the other main ones are rheumatoid arthritis, psoriatic arthritis, spondyloarthritis, ankylosing spondylitis, and then a whole bunch of connective tissue diseases like lupus, myositis, Sjogren's disease, scleroderma, and many more, as I said.
And what are the lifestyle changes which we can adopt to at least delay or improve our conditions?
It's pretty broad again. We don't have a good answer for this. We don't have any trials or real evidence for exactly how it does, or what is the right prescription to prevent it from happening. But I think before we talk about how to prevent it, I guess we have to talk about, well, how does this generally happen? The biggest one is genetics. So if you have a first-degree relative, like a parent, sibling, or children, if they have an autoimmune disease, you are more likely to have it. And this is something we cannot avoid or change, of course. The other one is gender. So females are more likely to have it than males. But the ones that I would say that are modifiable risk factors are smoking. We know that smoking can lead to autoimmune diseases, recurrent infections of a variety of types, often viral or bacterial, as well as dental disease. So we know that certain dental diseases may predispose or make it more likely for you to have autoimmune diseases. So when we know a little bit around how it can happen, I guess you can talk about, well, how do we prevent it from happening? One of the main things, I guess the biggest branch I would say, is to keep yourself as healthy. So watch what you eat, minimize it. Often I hear from my patients that they find that very high sugar intake based foods or ultra processed foods, so packaged foods, They often lead to issues with arthritis in particular, but also other autoimmune diseases. So avoiding that to start with, I think, would be a very good way to prevent this from potentially happening. But also regular exercise. So trying to keep yourself active regularly, at least 3 to 5 times a week. And that can be a variety of different types of exercise, and that can mean a lot of things for different people depending on your fitness level. But these are some of the main things I would say that would be able to help you from prevention. And then trying to stay away from, substances like tobacco and smoking. Symptoms can worsen if you are still consuming these things.
Okay. What is vasculitis and how to identify it early?
So vasculitis is what we call an inflammation of blood vessels. This is where the blood vessels, for some reason, again, we don't understand why, they can become inflamed and swollen, and what can happen, the worst case scenario in that is that these blood vessels then rupture. Now this can be broken down into different vessel types. So one is called large vessels, or the biggest by size. There are medium vessels and then small vessels that can become inflamed. The small vessel vasculitis is the one that we often worry about the most because untreated it can lead to death. So we have to be very vigilant for that. The main symptoms that a rheumatologist will always deal with are joint pain, which may be accompanied by a whole parameter of other symptoms. But the main other active symptoms which may suggest or consider, the possible diagnosis of vasculitis include unexplained weight loss, fevers, lumps or bumps around the neck or underarms, what we call lymph nodes being enlarged, breathing difficulties, bleeding from urination, but also skin rashes that have started to come on. These things accompanied with joint pain will probably make you think it's better off seeing a rheumatologist rather than one of the other specialists.
And is it so that in autoimmune disease, everything starts to go wrong a bit with everything?
It can, it doesn't have to. So some autoimmune diseases will only affect certain organs and nothing else. But then there are others, like vasculitis, that can affect multiple organs. So that's why I find it hard to explain what a rheumatologist does, because we often delve into dealing with other organs as well, not just joint-related symptoms. But again, that's the most common stuff that we see.
How will you educate people so that they shall come early to your clinic or to rheumatology clinic?
Yeah, it's of course awareness is really important, and the main things that I would recommend if patients start to feel these, they're probably better off seeing a rheumatologist rather than anybody else. And they are mainly around pain in the body. So if you have joint pain or any muscle-based aches and pains that are prolonged for a few weeks and they haven't gone away, if you have pain, particularly when you wake up in the mornings, and stiffness or feeling that you cannot move as well, again, within half an hour or more, I think that would make me suspicious that this is an inflammation thing going on. The other major thing is in terms of activity. So when your symptoms improve with activity and get worse with inactivity or staying idle, that can be signs that you're better off seeing a rheumatologist rather than other pain-based specialties. I just say, try and keep yourself as healthy as possible, and that often it gets broken down into broad categories. We've talked on diet and exercise, reducing stress levels, which is always easier said than done, but also making sure you have good, what we call sleep hygiene. So sleeping the right amount of hours in the right time frame, and having the best possible quality of sleep will generally lead to better outcomes. And again, we've touched on things, stopping smoking, and of course abstaining from alcohol as well. So I think that's the biggest message from a health perspective, which I think will lead to better outcomes. And it's not just for autoimmune diseases. These will improve a lot of other things as well, as diabetes, all kinds of vascular diseases like risk of strokes and heart attacks and so on.
So thank you very much, Dr. Mueed. We are highly thankful to you for your valuable input and guidance.